Lowe syndrome is a genetic disorder that affects approximately 1 in 500,000 people in the population. Its low prevalence in the population causes it to be lesser known to the general public. Today I'm going to tell you about the causes, effects, and therapy or management strategies for this rare disorder. There are two main causes for this disorder: random mutations and genetically inherited mutations. About 1/3 of the males affected by this disorder are affected from the genetic mutation, according to the National Organization of Rare Disorders. This is an X-linked mutation, which means that the mutation is in the X chromosome. So since males have XY, this means that they only need one copy of the mutation to have the disorder. However, females need 2 copies of the mutation to have the disorder. Though with only one copy, they can have symptoms shown from the disorder, such as vision impairment. The OCLR1 gene is where the mutation occurs, which is the oculocerebrorenal gene. It alters the enzyme, and the enzyme cannot bind to its target molecule, so therefore it cannot perform its function. It's not really known what the enzyme does, other than it performs several different functions in the cell, such as helpful in cell motility. OCLR1 mutations vary in their severity depending on what kind of mutation, and this can have different severity outcomes for the individual, according to the National Library of Medicine. There are several effects of this disorder that come from the mutation. So the Lowe Syndrome Association characterizes it by cataracts, glaucoma, kidney problems, seizures, behavioral problems. Those are all the common symptoms of this disorder. And also, in an article by Gene Reviews, the individuals rarely surpass the age of 40. Some less common symptoms are hypotonia, which is muscle weakness or low muscle tone. There's also concerns for low muscle density, low bone density, scoliosis, and dental problems that can present themselves. Some therapy and management for this disease. There is no cure for the disease, and there's no medications to fix the enzyme so that it performs its job properly. So some of the therapy management strategies. For low muscle tone, feeding management is usually the key. Sometimes tube feeding is necessary. The removal of cataracts. So after removal of cataracts, usually glasses or contacts can help correct the vision, though it will never be 20/20. Glaucoma usually occurs in about 50% of males that have this disorder, and this can be helped with eye drops. If not with eye drops, surgery usually can clear the glaucoma. Kidney problems are also a problem. Oral supplements are given for these. Behavioral problems are just remedied with behavioral therapy and sometimes medicine for these behavioral problems. Phosphate and calcitriol prevent rickets from happening, and seizures that are sometimes present are just given anticonvulsant convulsant meds as well. And in later down the road in the disorder, when kidney failure is occurring, sometimes dialysis and kidney transplant can help. What's most recommended, though, for this disorder from the National Organization of Rare Diseases is early intervention with physical therapy, speech and language therapy, occupational therapy, special education services, and services for visual impairment. With this rare disorder, only 1 in 500,000 people have the disorder, but it's a very life-changing and severe disorder most of the time.